Hi there, my name is Dr. Jason Strandberg. I'm the medical director at Lake Minnetonka Mobile Wellness, and today we're going to talk a little bit about migraine headaches. Now, migraine headaches are a very common type of headache. They tend to be pounding headaches on either one or both sides of the head. Usually have some sort of a aura that precedes them. It could be many different types of auras, smell, sound, taste, other sensations that precede the migraines, and they can be relatively severe, lasting hours to even days. So, a migraine headache is a pounding headache that may affect one or both sides of the head. It's often preceded by some sort of aura, and the auras again could be a they could be a smell, a taste, a sound, a sensation, tingling, numbness, some sort of thing that precedes the symptoms the symptoms of the headache, and then the headache is often accompanied by nausea, vomiting, sensitivity to sound, light, smell, and there can be a whole bunch of things that trigger them. Now, migraine headaches, the typical, or I shouldn't say typical, the classic migraine, the one that people tend to describe the most, is always preceded by an aura of some sort for hours often before the migraine comes on, sometimes just minutes, but many times it lasts for hours. And it comes along with some sort of sense of unwell that precedes this migraine, and then it will tend to throb on just one side of the head, and you'll have that sensitivity to sound, to light, um, to smell in many cases. Patients will just want to be in a dark room, but in the classic migraine, it sticks to one side of the head. Now, the common migraine, as its name would tell you, is actually far more common than the classic. It may or may not be associated with an aura, and the auras could be long or they could be short when they do happen. But the throbbing pain might begin on one side or the other, or on both sides, but often then will migrate and affect the entire head. In either case, a migraine headache is considered a vascular headache, which means it's a pulsating headache because of the dilation and the constriction of the arteries in and surrounding the brain. So it's not actually the brain that hurts, it's the arteries around the brain that are causing all this pain. A migraine headache will generally last several hours, up to, in some cases, up to 2 days. Now, the causes specifically, there are arteries that surround the brain. This is just one example of it, but the blood vessels will tend to dilate, sometimes even with an alternating dilating and constricting. But as the arteries dilate, now there's more room for the blood to flow through, but the blood then gets thrown harder against the walls as it's coming into the arteries. And it's that movement, every time your heart beats, blood is forced and thrown into that artery in your brain, or those arteries in your brain, and it tends to cause pain every time it hits those walls. So all migraines have a vascular component to them. You'll hear people talk about hormonal or even serotonin related migraine headaches, but in the end, those hormones that trigger migraines cause vasodilation, and a lower than normal level of serotonin in your brain can also cause vasodilation. So in many cases of chronic migraines where people are suffering from multiple migraines a week or even several a month, are also associated with lower than normal levels of serotonin. Now, the triggers, any number of things can trigger a migraine. Hormonal changes in women. This is an interesting piece. Most women will not experience migraines as little kids, but when they go through puberty, they might start to experience them. And women who do get migraines will often get them at the same time every month in their cycle. Now, that being said, if hormones cause them, if you are taking a hormone replacement of some sort or hormone medication like birth control, they can sometimes trigger migraines. Interestingly enough, some women who have migraines normally will stop having them when they start taking birth control. Because the hormone fluctuation is not as great when you're taking birth control pills, then the blood vessels will maintain a more consistent and constant diameter. Alcohol and red wine, especially red wine, have nitrates in them, and nitrates are associated with vasodilation. This is why nitroglycerin works so well for people who are having chest pain, because it opens up the arteries around the heart. And this is also the way that most of the erectile dysfunction medications work, using a chemical that keeps nitrate levels high, which then causes vasodilation in the penis. Well, if vasodilation can be caused by nitrate medications, then nitrates in food may also cause them. And by the way, one of the most common side effects of nitroglycerin and of erectile dysfunction medications is migraine headache. Caffeine. Now, caffeine itself doesn't actually cause migraines, and in fact, it might be used to treat them, because caffeine causes vasoconstriction. But if you suddenly stop consuming caffeine, say you're a 5 or 6 cup of coffee a day person, and you stop consuming caffeine altogether, the odds are pretty good that you're going to get a reactive migraine headache, a caffeine withdrawal headache. Stress may trigger migraine headaches, and this could be all sorts of stress: emotional stress, physical stress. But the effects that stress has on certain hormones, especially adrenal hormones, things like cortisol levels being elevated, can have an effect on the blood vessel diameter and cause vasodilation, which will trigger the migraines. Some people have migraine triggers that could be any sort of sensory stimuli. Think of a strong smell. People who tend to say they're allergic to certain perfumes or what have you, they aren't really allergic to them, but they're having a reaction that triggers a migraine or something similar. Bright lights, flashing lights are another common migraine trigger. Loud noises can also bring on migraines in certain cases. Sleep changes, specifically lack of sleep or inconsistent sleep, seems to be a good trigger for migraine headaches. Weather changes. If the atmospheric pressure is dropping on the outside, that means the pressure pushing inward on the arteries is less, so the pressure pushing outward from your normal blood flow may actually trigger a migraine headache. There are a number of medications out there. We've already talked about birth control, but medications that lower blood pressure may actually trigger migraines, and foods with certain chemicals and additives. Here we're talking mainly about things like aged cheese, processed deli meats with nitrates in them to preserve them, chocolate, especially dark chocolate, all things that can trigger migraine headaches. So to diagnose a migraine headache, mostly this is done by history and physical. Now, if the migraine headache, if the headache is a pounding headache that either starts on one side or stays on one side and is preceded by an aura, it's pretty much a slam dunk. If it lasts, especially if it lasts for hours to days, if it's a more intense one that only happens at night, then we tend to call that a cluster headache. It's still often treated in similar ways, but migraine headaches are more common. And just by doing a good history and exam, you can usually diagnose. A good neurologist, a good chiropractor, a good physical medicine doctor can pick out a migraine. For that matter, a good family practice or internal medicine doctor should be able to diagnose a migraine headache. If there are some things that seem a little odd, that just don't seem to fit the picture of a normal migraine headache, coming on at a strange point in life. If you see a headache coming on in a 50-year-old that's never had headaches before, that's usually a sign something else is wrong. Metabolic, it could be metabolic, it could be tumors, it could be all sorts of things. And so if that's the case, we might want to do blood tests. We might want to do an MRI or a CT to rule out tumors or bleeding in the head. But in most cases, we don't do that. We just do the history and the physical. And then one thing that I like to do with patients who come in with migraine headaches is have them keep a journal. What are you doing? What are the physical activities you're doing? What are the things you're eating? And then if you have a migraine, let me know. So if this day you have fruits and vegetables and blah 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 and you're just fine. This day you just continue to have the normal diet, have the normal amount of coffee, you're fine. But on this day you went out to a party and you had 3 glasses of wine, a whole bunch of aged cheese, some hors d'oeuvres that had salami or some other pepperoni or something like that, and you finish it off with dark chocolate, you've got a pounding headache. Well, okay, we know what caused it. Most of the time it's not that straightforward. Most of the time it's, oh, I just had this one thing, and about 4 hours later I had a headache. Or I went for a run, and 2 hours later I had a headache. Well, if we can figure out what those things are that are triggering them, and either get rid of those things in your life, um, or do something to help you adapt to them, then you're going to have fewer migraines and less. So the prognosis for a migraine headache tends to depend on what your treatment choice is. People with chronic migraines tend to have them throughout their life, but treatments can prevent their recurrence. Avoiding triggers can help prevent them. So if red wine is a trigger, don't drink red wine. If MSG is a trigger, don't eat foods with MSG in it. Prophylactic medications have to be taken on a regular basis to prevent the migraines. So if you're taking an SSRI for your migraine headaches and you stop taking them, the migraines will come back relatively soon. Botox typically lasts about 3 months. So at the end of that 3 months, you might start to notice a mild migraine coming back on. And if you don't get that follow-up maintenance dose, you will probably start to experience migraines more like you did before treatment. If you choose spinal manipulation and acupuncture as your treatments, quite often, if you feel an aura coming on and you can get a treatment within the first hour or two of that aura, that might be all that you experience. You don't actually get the full-on headache. I tell my patients who are using manipulation and or acupuncture for treatment that it's one of those things that if we can keep you on a consistent treatment basis, say one treatment every couple of weeks, or in some cases even as much as every month, then you'll have far less of these headaches. And then if you call, and when an aura is about to happen, you will be able to head that off a whole lot easier. So at Lake Minnetonka Mobile Wellness, as I told you, we offer chiropractic, we offer acupuncture, rehabilitation, massage. We also have MDs who do primary care, anti-aging medicine, weight loss medicine. So if you're going to come to see us, if we're going to come to see you, remember we do house calls, so that's part of our gig. We will do a multidisciplinary approach. Most likely we are going to recommend some sort of manipulation and either muscle work or acupuncture to help cut off your migraines, help to treat them. But we also will probably bring in our medical providers and talk to you about different medications that are also options. So, if you have a migraine headache, if you're having problems with them as a chronic condition, we can help you out of that problem, and in most cases, our patients do get significant relief relatively quickly with treatment, and as long as they follow up on a regular basis with the treatment that we prescribe, they do pretty well. So if you're looking for help with migraine headaches or any other health problems that you are trying to battle, trying to deal with, or if you're just interested in being at the top of your game and being able to perform well for your work, for your hobbies, for your friends and family, if you want to be the best mom or dad you can, we are there to help you. We will come and treat you at your home, at your workplace, or you can come and see us in office. Give us a call, 952-222-7886, or check us out online, Lake Minnetonka Mobile Wellness.